So today we have a 63-year-old male, and he had an assault in 1979 that led to a laceration along the left cheek in a horizontal fashion. He got stitches at the time, and I'm looking at my notes to make sure I get the details right. But he developed some keloids. Then he underwent repair the next year. That didn't help much. And then he had to undergo radiation and steroid injections. So that was pretty tough, I'm sure. Then later on, he had something that I think sounds like a Z-plasty towards the lateral aspect. And it improved after that, but still has a long horizontal scar. And it's very obvious in the mid left cheek area and touches the nasolabial fold right there. And it starts becoming wider as we go along. And there's some depressed area as well. The most prominent portion is the horizontal part in the medial cheek right here. That's the most prominent. And then later on becomes a little flatter over here. So this lateral portion doesn't need anything, but this portion definitely needs something. So there's various different options to get rid of the depression. One was elliptical excision in the medial aspect and pulling the fat from the top, pulling the area downwards along with the fat from there to put it together and let it heal. Once it's completely healed, the depression is gone, then do a Z-plasty to hide it. That's one option. Second is include the medial portion into an excision of the nasolabial fold. So like bring it longer and make a part of it. So just take the whole thing out. And do maybe that's a depressed one, and do maybe a Z-plasty for the lateral portion right here. So I think that would be great. Problem is, given the history of keloids, the patient is apprehensive, radiation history, so who knows, this makes it complicated. So we went to the last option that patient wants to try, which is maybe fat grafting of the depressed area and see how it works. And if it works, he's happy, he's good. In order to see if he's gonna like it, we are doing saline injections today to see if the temporary effect of saline, which most likely he will have afterwards, will work or not. So let's go take a look. See, scars are complicated. They are, you gotta think them through and come up with the best possible solution. So let's go take a look. Okay, so we have a very nice gentleman who is my countryman. So I'm very excited. I'm originally from Pakistan, and I didn't even realize the first consultation, we just kept talking. We didn't even talk about our ethnic backgrounds. And finally, I had to ask, and lo and behold, he comes from the city of Karachi, where I did my med school, Aga Khan University. So I'm very excited. I really, really want to help this nice gentleman. So as you can see, as we talked about, it's like there's a depression right in the center, the horizontal scar. The top is like looking fatty, and the bottom a little bit as well. But in between, there's a whole valley, and that's the valley we want to fill up. Today, we'll do saline injections and see if it looks better. And if it does, then we know we can maybe try the fat grafting, and along with that some laser. And if that doesn't work, we can always go to the excision part of it. So let me show you the lateral part, because the lateral part is much better, but I cannot show you the identity of my dear friend here. So you can see the old Z-plasty scar at the lateral most aspect, and as we go along, some of the scarring right here. So obviously the fact that there were some keloid formations in the past makes it very tricky, and we have to proceed with caution, and that's exactly what we'll do. Very good. So we are done injecting. As you can see, it has really effaced that depression, but at the same time, because of the chronic scarring, it is impossible to completely elevate it. It's not very easy, and this gives us some idea as to what we can expect. And as you can see, the difference between the superior and inferior portion is not as pronounced. And we might be able to get a good result from just fat grafting, and if not, we have many different options. So, but at least with saline, the patient gets a chance to observe for the next 2-3 days what it looks like, and then decide. So we'll keep you posted.